Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in forensic medicine, and today we will start with abortion. From this video, we will discuss mainly about abortion, its legal implications, and in today's video, we will discuss about introduction to abortion. So coming to abortion, medically, abortion is defined as the expulsion or extraction from its mother of an embryo or a fetus weighing 500 gram or less, which mainly comes around 22 less than 22 weeks of gestation when it is not capable of independent survival. It is also called as viability, it is more than 28 weeks. So it defines that expulsion or extraction of a ovum from the mother uterus, which the fetus is less than 500 grams. So that mainly it includes the fetus which is less than 22 weeks of gestation, or when it is not capable of independent survival. So usually at around 7 months of pregnancy, the fetus becomes viable in the sense that if it is even delivered, it can survive on its own without the help of the mother. So if it is delivered more less than within 28 weeks, then it is also considered as abortion. Legally, abortion is defined as expulsion of products of conception from the uterus at any period of full term. So here they have not restricted any weeks of gestation. So legally, it is defined as expulsion of any products of conception from uterus at any period out of full term. So from conception, from the time of fertilization till the full term, any time if it is expelled, it is considered as abortion, which is legal definition. So products of conception, which is included legally, includes fertilized ovum, that is from fertilization till implantation. So from fertilization part till it getting implanted, that is between first and second week. That is, if it is expelled, it is also product of conception. It also includes embryo, which denotes the developing product of conception after its implantation in the uterus up to the end of second month. So up to second month, it is called as embryo, which is also product of conception, and fetus, that is from third month till birth. So this all comes under as a products of conception, and legally, if any part of these products of conception is expelled, it is considered as an abortion, which is legally considered as abortion. Now coming to classification of abortion. So abortion per se can be classified into natural abortion or spontaneous abortion and artificial or induced abortion. So it can occur naturally, and can be induced or artificially can be made. So in natural, it can be threatened abortion, inevitable abortion, complete, incomplete, missed, or septic. So there are different reasons are present. So mainly it may be suddenly it may occur, it may be completely expulsion, incomplete expulsion, it may occur by infection like septic, or missed abortion, it may also occur. So in the induced abortion, it can be legally done, that is justifiable. It mainly includes the which is done in government practice, that is MTP, and that is medical termination of pregnancy, which was came into force as MTP Act 1971, which is revised recently. And based on these indications in the proposed in MTP, abortion can be done legally in certified authorized government centers or authorized private institutions which have granted to conduct MTP. Then there can be artificial, can also be illegal abortion or criminal abortion, which is commonly seen where the woman doesn't want the fetus, or in cases the in-laws of the woman may not want the fetus. In that case also criminal abortion is carried out. So coming to natural abortion, so it is an abortion that occurs spontaneously without an induction and usually coincides with menstrual flow. So woman may not even know that she is pregnant, and she may just have a menses. She may assume that she has been having a menstrual flow, and the product of consumption may just be expelled. So it is so spontaneous, and there is no induction, means there is no predisposition which is present. There is no induction procedure, like if any she is try to remove the consumption by insertion of any foreign objects, or no instrumentation is used. So there is no induction process is done, and it occurs naturally, spontaneously, and she may assume just has a menstrual flow. It is seen in many cases, like 10 to 20% of all pregnancies, natural abortion is seen. Most frequently, it occurs at the time of first 3 months, at the time, since there is weak attachment of ovum to the uterine wall. So because of owing to that, there is chances many times abortion occurs in this period within 3 months of conception. The cause of natural abortions are many like genetic causes, anatomic causes, endocrine, infections, immunologic and others. Coming to genetic causes, so genetic causes mainly because of chromosomal abnormalities. So as we all know, we have 23 pairs of chromosomal pairs. Sometimes there may be extra pair which is called as trisomy, that is one pair may be extra chromosome, mainly trisomy 16 is 30% causes is mainly seen, or there may be monosomy where one of the chromosome is absent, or there may be chromosome aberration where there may be addition of a part of a chromosome or deletion, or there may be some branching of the chromosome. So chromosomes are which are usually present as a pairs, there may be part may be deleted, some part may be deleted, or some part may be added, there may be branches, deterioration may occur. This comes to about 20%, that is monosomy is in 20% and 2 to 4% of chromosome aberrations are seen. These are the main reasons where the because of this genetic chromosome abnormalities, many times spontaneous abortion occurs. Anatomical causes, this mainly includes the anatomical defects seen in the cervix and the uterus part. So this usually occurs in around second trimester cases. There may be cervical incompetency. So cervix usually closed and occluded in most of the commonly uterus, and sometimes because of cervical incompetency, it may get dilated or it may be dilated. Products of conception may be expelled. Congenital malformations of uteruses, many times congenital malformation may occur in uterus. It may like hyperplasia, there is size in decrease in size may occur. There may be bicornuate or septate uterus, so in which there is two uterus is seen and single opening in the single cervix or vagina, or duplication of upper parts of the uterus may be seen. So many times septate uterus may be seen. This is a bicornuate uterus, and in sometimes in uterus a septa may be present where it is not been completely fused. So this in this case also the process of conception or fetus is able to develop because it cannot have doesn't have enough space for development. There may be cases, fibroid cases also, the abortion may occur. Now, endocrine abnormalities mainly hormonal disturbances like diabetes mellitus, hypothyroidism, decrease in thyroid, increase in thyroid hormones, luteal phase defects, which may lead to abnormalities in progesterone and estrogens, deficient progesterone secretion from corpus luteum can also lead to spontaneous abortion. The infections, viral infections, Ebola, cytomegalovirus, HIV, variola, bacterial infections like chlamydia or brucella or parasitic infections like malaria can also cause spontaneous abortion. The immunological mainly it may be autoimmune where body itself try to remove the products of conception by developing antibodies against the fetal materials, or alloimmune where the antigens are introduced from outside, and because of that antibodies may develop against the fetus and may lead to spontaneous abortion, leading to miscarriages or abortion. Then some other causes like heart diseases, immunoglobulopathies in the infant fetus itself, some anti-fetal antibodies, blood group incompatibility if the mother is Rh negative and she has developed some Rh positive antibodies, it may lead to, and the fetus is Rh positive may cause abortion. Premature rupture of membranes, environmental factors like if a woman is chronic smoking or the husband is chronic smoker and the woman becomes a passive smoker, certain drugs, chemicals, noxious agents, contraceptive agents, sometimes in situ contraceptive agents like introduction of IUDs, intrauterine devices like T-tube, it may cause IUDs if it is left inside and it is absent. If it is absent-mindedly left inside the uterus, that may also cause abortion. X-ray exposure or antineoplastic drugs can also there. Then lastly, unexplained causes. So many times more than 40% of cases, many times our cause is not known, just the spontaneous abortion occurs. Next is the artificial or induced abortion. So artificial induced abortion is the willful termination of pregnancy before viability, that is less than 28 weeks, 28 weeks of gestation. So this is willful. The woman itself wants to terminate the pregnancy willfully. So that is artificial or induced abortion. Natural abortion occurs spontaneously without any induction. Artificial is induced by many methods, and it is willfully done by permission by the mother's will. So mother's will may be present or may not be present based on how the abortion is done. So as I mentioned in classification, it can be legal or justifiable when it is done in good faith to save the life of a woman or some other indications performed within the legal provisions of MTP Act. So under the MTP Act, it is done. There are few indications where it is done. Then criminal abortion, which may be done against the will of the mother. In this, there is induced destruction and expulsion of fetus from womb unlawfully. So unlawfully, the fetus is expelled from the womb of the mother. It is usually done before the third month and may cause infection, inflammation of the endometrium. This is the done usually to remove unwanted pregnancies. It may be done willfully for mother may herself may do it, or the family members of the family can be done against the will of the mother. So in next video we discuss about mainly about justifiable causes, that the MTP Act, and in future videos we'll discuss about the criminal abortion. These are my references. Thank you.